ఇప్పుడు వస్తుంది బాగా. రాట్లేదా మాట్లాడు. మాట్లాడు. మాట్లాడు.
హలో
గట్టిగా మాట్లాడు.
హలో హలో హలో
రావట్లేదా?
Yeah, you are audible.
వస్తుంది కదా. వస్తుందా?
హలో హలో హలో
Sir, you are audible.
ఓకే ఓకే సార్ ఓకే ఓకే
Dr. Saptarshi Banerjea, sir. Very good afternoon to you. Welcome to Homoeopathic Medical Association of Telangana, sir.
ఇదైపోయిందండి, మిస్ అయిపోయిందండి. అమ్మో
Hello. Hello.
ఇక్కడ అయితే ఉంది వాల్యూమ్ ఇక్కడ వాల్యూమ్ చూపిస్తుంది మరి అక్కడ వాల్యూమ్ నా వాయిస్ వినపడుతుందని అడగండి. హలో దుర్గా ప్రసాద్. హలో
సార్, గుడ్ ఈవినింగ్ సార్.
గుడ్ ఈవినింగ్. వినపడుతుందా వాయిస్?
వినపడుతుంది సార్, చాలా క్లియర్ గా. వీడియో ఆడియో బ్రహ్మాండంగా వినపడుతుంది సార్.
వీడియో ఆడియో
బాగున్నాయి సార్. ఇప్పుడు మీరు అన్మ్యూట్ చేసుకుంటే మళ్ళీ మీరు మాట్లాడేటప్పుడు మ్యూట్ చేసుకోండి.
అన్మ్యూట్ అంటే అన్మ్యూట్ చేయమంటారా?
అన్మ్యూట్ చేయనా?
మ్యూట్ చేయమంటారా?
ఇప్పుడు మ్యూట్ చేయండి సార్.
ఓకే.
అంటే మీకు వినిపిస్తుంది కానీ మీరు మాట్లాడేది ఇంకోరికి వినిపించారు సార్. ఎప్పుడైతే మాట్లాడాలనుకుంటారో అప్పుడు అది మళ్ళీ ఆ బటన్ ప్రెస్ చేసి మాట్లాడండి సార్.
మీరు మాట్లాడాలనుకున్నప్పుడు అన్మ్యూట్ బటన్ ఆన్ చేసి మాట్లాడండి.
ఓకే, రైట్.
సార్, షల్ వి స్టార్ట్ సార్?
ఓకే, వెయిట్, క్యారీ ఆన్.
Dr. Vaishnavi, please start the evening's proceedings, please.
Hello. Hello. Hello.
A little louder, ma.
Hello.
వినిపిస్తుందమ్మా, కొంచెం గట్టిగా మాట్లాడమ్మా.
Okay, sir. A very good evening to one and all. Homeopathic Medical Association of Telangana welcomes all the delegates of the evening on the eve of this World Homeopathy Day. Now, I would like to welcome our President, Dr. K. Gopal Krishnaji, our General Secretary, Dr. Durga Prasad Rauji, Convener, Dr. Sampath Rauji, and Honorary Advisor of our Association, Dr. Shivashankar Kunapareddy. So, amidst the second wave of COVID-19, which is freaking our subcontinent and pandemic, bringing our humanity to its knees. So, homeopathy shines as a beacon of hope to the suffering that no words of Hanuman, that all the words of Hanuman bring to 225 years down the line when it was written. We take this opportunity to celebrate, commemorate, and reaffirm our faith to unflinching hands of homeopathy. This evening is special for us in this respect as we bring on to the platform our very young and dynamic homeopath, Dr. Saptarshi Banerjea ji, the resource person of the day. Now, with due respect, I would like to hand over to our President, Dr. Gopal Krishnaji.
Hello, am I audible?
Very much, sir.
Good evening to everybody and pranams to all the audience. And I extend hearty welcome to all the delegates for this session. And our warm greetings and good wishes on the eve of World Homeopathy Day. And while commemorating the 266th birth anniversary of our founder, Dr. Samuel Hahnemann, we are organizing this event. And I heartily welcome all the delegates and our revered advisor, Dr. Shivashankar Garu, our past president, Dr. Sampath Rao, and convener for this Zoom session, and Dr. Venugopal Gauri, co-convener for the Zoom session, and our general secretary, Dr. Durga Prasad Rao, and all the executive members, veterans, and all the participants. Hearty welcome to you all. Today, this evening, we are going to hear from a young, dynamic, extraordinary homeopath, Dr. Saptarshi Banerjea. He hails from Bengal. So Bengal has been a great contributor to homeopathy in the entire subcontinent of India. So from the day of its origin in India, so Bengal was in the forefront, and many of the Bengal stalwarts have been contributing for the furtherance of homeopathy. So our Saptarshi Banerjea is a great son of Dr. Subrata K. Banerjea, and he is the 5th generation doctor from his family. So I welcome him. I extend a hearty welcome to our speaker and all the audience. And we would have a very fruitful, useful, and inspiring session this evening. Thank you, one and all.
We request the convener of our association, Dr. Sampath Rauji, to take over.
Good evening, everybody. Dr. Shivashankar Garu, our honorary advisor. Dr. Gopal Krishna Garu, our president. Durga Prasad Rao Garu, our general secretary. Venugopal Gauri Garu, our treasurer. And the executive members, the members, the guests, the invitees. At the outset, I wanted to convey my best wishes to all of you on the occasion of the World Homeopathic Day, which is in commemoration of 266th birth anniversary of our founder, Dr. Samuel Hahnemann. You are aware that yesterday and today, the celebrations in associations for the homeopathy and at the individual level, the celebrations in homeopathy is going on world over to commemorate the 266th birth anniversary of our founder of homeopathy, Dr. Hahnemann. On this occasion, I appeal to one and all of you. So let us take the inspiration from the Hahnemann regarding the principles. Let us implement them in its true spirit for treating the sick people, and let us imbibe his characters to take homeopathy to the next level. His persistent hard work, his courage to accept the mistakes and correcting them, the relentless effort to search for the new truth, accepting and inviting the other's opinion and accommodating them. He is relevant today also. The world is facing the health crisis of the century, COVID-19. During this crisis also, Hahnemann's principles, they are relevant. In the 18th century, before the microscope was invented, not only he identified the microbes, but also taught the plan of treatment and how to tackle the microbial infections. And today's microbial infection, world over, millions of people, they got benefited with this pill by following the principles of Hahnemann in its spirit. Once again, I request to every one of us, so let us follow the principles of Hahnemann and let us imbibe the characters of the Hahnemann to take this science to the next level. First, by implementing the principles in its full spirit, and next, by imbibing his characters and finding the new methodologies in implementing, if any difficulties we come across in implementing the principles, by that way, we will be helping the system to grow, and we will be helping the people to get benefited by homeopathic medicines. So with this few words, once again, I convey my best wishes to every one of you on the occasion of the World Homeopathic Day and on the occasion of our Dr. Samuel Hahnemann's 266th birth anniversary. Thank you.
Thank you, Dr. Sampath Rao, sir. Requesting our General Secretary, Dr. Durga Prasad Rao ji, to take over.
Thank you, Venu. Good evening, all. And thank you, Dr. Sampath Rao, sir, for your tributes to Hahnemann and the present status of the world homeopathy. Thank you for your valuable contribution on this auspicious occasion. And now I also join our president and Venugopal or Sampatrao sir to invite you once again, all of you, to this interesting session by our chief guest and revered speaker, Dr. Saptarshi Banerjea from Bengal. And on the occasion of World Homeopathy Day, commemorating 266th Ariman's birthday celebrations. And here I want to say about our association a few words. Because our association, Homeopathic Medical Association of Telangana, which is the oldest and the biggest association in India for the last 60 years, now being named as the Homeopathic Medical Association of Telangana. And we conduct all these programs physically by arranging seminars, monthly seminars, and daily OP clinics and specialty clinics and other services, and educating the junior doctors and inculcating the homeopathic practice knowledge to the young dynamic physicians. And now, due to the ongoing pandemic situation, since last 1 year, we have been conducting these webinar sessions successfully. And today also, on the occasion of World Homeopathy Day, we have gathered to view the session by Saptarshi Banerjee. And before that, I want to thank all our association members and the old executive committee, outgoing body, and which have completed the successful tenure of last 2 years. And I also congratulate the new governing council body, the president and the secretary and all the executive members and office bearers for the coming 2 years from April 2021 to March 2023, 2 years tenure. I wish all our team will work effectively for the promoting the homeopathy in public health. And this year, on the occasion of World Homeopathy Day, the theme of the World Homeopathic Day is enhancing the scope of homeopathy in public health. And it is almost the recent, the World Homeopathic Day was celebrated on 7th April. And the WHO, World Health Organization, also came front with a theme of to build a fairer and healthy world. This is almost same. The theme of homeopathy and the theme of the integrated system of medicine and the modern medicine and World Health Organization are looking same. So I hope we can work on the lines of that theme for this year and promote homeopathy in a successful way. And now this is time to introduce our chief guest, Dr. Hello. I request you to unmute. And today, this is my privilege to introduce our review.
Kusanta?
Dr. Durga Prasad Rao garu, your mic has been muted. Please unmute.
Am I audible?
Please go ahead.
Yeah, very much.
Okay. Thank you. Dr. Saptarshi Banerjea was born in Calcutta, India, the 5th generation of a distinguished and widely respected homeopathic family. His insights into prescribing with his magnificent prescribing magnificent grasp of the nuances of Materia Medica, make his lectures wonderfully rewarding and give him confidence in prescribing, especially in cases with pathology. He acts as a clinical consultant in various rural and slum clinics. In India, he often sees around 50 patients a day in his medical centers. Such volume requires the use of extensive ready knowledge of clinical and comparative Materia Medica, coupled with profound intuition and application of ancestral wisdom. Saptarshi inherits his clinical acumen and wisdom from his illustrious father, Dr. Banerjea. Dr. Saptarshi Banerjea is a popular young lecturer, and his dedication to the truth of homeopathy is regarded as inspiring and unsurpassed. His enthusiasm for the old school classical homeopathy and his practical implementation in drug-dependent modern world is awesome. Dr. Saptarshi regularly runs a 2-year postgraduate program for medical doctors in Bangkok since 2013. He also conducts a 2-year video-linked postgraduate program for USA and Canada. He has completed a 2-year PG program in Tokyo, Japan for more than 35 students in 2020. All this about our Saptarshi Banerjea. Now I request our speaker, Dr. Saptarshi Banerjea, to deliver the lecture. Now I request our speaker, Dr. Saptarshi Banerjea, to present his views on the comparative Materia Medica of dermatology. I welcome you, sir.
Thank you very much for the kind introduction. Good evening to everyone, those who are joining in on this wonderful occasion of World Homeopathic Day, the birthday of our Master Hahnemann. It gives me great pleasure to be sharing with you today, or to have a platform to share with you about homeopathy and how even 250 years later, homeopathy still is valid and still is required in today's modern day world when people are reeling under the effect of conventional chemicals. I'll be sharing with you a very interesting topic today of comparative Medica and dermatology. As you understand that I hail from Bengal, or the eastern part of India, which was once known in pre-independent India as the Mecca of homeopathy. People from all over the world used to come and study in Bengal, and my college, especially the Calcutta Homeopathic Medical College. George Vitulkas came here, P. Sankaran, father of Rajan Sankaran, came, Dr. Kopikar came to study in the Calcutta Homeopathic Medical College. To learn what? To learn Materia Medica, to be very honest with you. And as time has progressed, you'll see that homeopaths are being confused often and often with new systems and new sensations and new methods. But somewhere down the line, we are missing out on what classical homeopathy is all about. And over the next hour, I'll be sharing with you simple classical homeopathy. That's what my family has promoted over the generations. And to be honest with you about simple classical homeopathy is where you can look at the patient, where you can prescribe on what you are seeing. I'll give you a brief history about my heritage and my families before we begin off. I'm the 5th generation homeopath in my family, perhaps the longest serving homeopathic family in the world. And my great-great-grandfather was a homeopath in late 1800s in Calcutta. And he was a homeopath in Calcutta, and he practiced alongside Dr. Sulzer. Sulzer was a very famous homeopath in those days in Calcutta, and he passed on to his wisdom to my great-grandfather, Dr. K.M. Banerjea. Now, Dr. K.M. Banerjea and Dr. N.M. Chaudhary were very good friends. I'm sure you have heard about N.M. Chaudhary's Medica. And both of them went to America to study homeopathy. Now, my great-grandfather went to study miasms from J.H. Allen, and N.M. Chaudhary went to study Medica from Kent. And both came back to Calcutta and started the Bengal Medical College. If you open N.M. Chaudhary's Medica, you'll see he is the principal of Bengal Medical College. And so one of them brought back the heritage of miasms, the other one brought back the heritage of Medica. And that's how Bengal became the Mecca of homeopathy in early 1900s in Calcutta. So whatever I'm going to share with you, I understand and learn that as an ancestral tip, that on one side of the coin is miasm, other side of the coin is the symptomatic totality. So miasmatic totality on one hand, symptomatic totality on the other hand. And Dr. K.M. Banerjea passed on his wisdom to my grandfather, Dr. N.K. Banerjea, who was continuing the Bengal Medical College, and he again passed on to his wisdom to my father, Dr. Subrata Banerjea, who has written the book on miasmatic prescribing. And I'm trying to carry forward that heritage of simple classical homeopathy. So my friends, over the next hour, I'm not going to share with you any new methods, new sensations, but I'm going to share with you how you can prescribe on what you see. I run a slum clinic in Calcutta where you understand, because of time constraints, we have to see almost up to 50 patients in a time span of 3 to 3.5 hours. And believe me, I don't have the opportunity nor the privilege to do a complete repertorization, but I still try to make a totality based on what I see, based on the totality of symptoms, which is reflecting on my face. And I'm going to share with you a few interesting clinical tips, which I've learned as ancestral tips over the generations, so that again, from tomorrow onwards, those who are joining in can go back and incorporate those in your practice. So as you can understand, I'm sharing with you, look and diagnose the skin, what do you see? And this I've been taught over not only by my dad and my grandfather, but what I've learned is sometimes the skin will itself tell you a story. So you may go on asking about, non-important symptoms, but common symptoms, but the skin is in itself a peculiarity. And I'll be sharing with you pictures over the next hour, which will reiterate the fact that yes, you can prescribe on the appearance, the peculiarities of the skin as well.
Santa?
If you look here, my friends, you can see here, this is a case of a cystic acne. And very many times you'll come across cases where there are large nodules, large bumps with the acne. And this was a young man with thick, yellow, lumpy discharge, which was coming out from the acne. So you can see with the arrow here, I pointed out that there is this thick, lumpy discharge. So there's this thick, lumpy discharge which comes out from the cystic acne, and you can see there's the bumps present there. And my friends, this kind of cystic acne, and do not get me wrong, but I'm going to share with you clinical tips, again, where you do not have a good totality, where you have prescribed a constitutional remedy, but it is not working. You're having failures with that. And in those cases, you'll always be helpful with these useful clinical tips. Now, cystic acne, soft swelling with the bumps, and from that, there's this thick, lumpy yellow discharge. My friends, do never miss a case of this with Calcaria sulf. Calcaria sulf is always a remedy where you will find this kind of thick, yellow, lumpy discharge. And it's always a suppurative discharge in Calcaria sulf. So you come across cystic acne, you look in Boricae's Medica, you'll find it's mentioned cystic swellings. And the characteristic of Calcaria sulf is that kind of thick, yellow, lumpy discharge. And it's always this nodular cystic acne where Calcaria sulf finds its value. Two indications always do remember for calc sulf is cystic acne, thick yellow discharge. It's almost like a toothpaste which is coming out, that kind of thick consistency. Many times you will come across cases where you may not get the yellow, but even the patient is telling you about the creamy discharge which is coming out. But the consistency is important, and that's the thick discharge. And that's characteristic for Calcareous sulf. Now, many times, my friends, whenever I'm doing a slump prescribing, it's sometimes important to understand the nature of the discharges. Similarly, I've been taught, and this is a very important ancestral tip, that whenever you come across cases where there's a thin, watery pus, thin, watery discharge which is coming out, it's always silica. My friends, you have to understand the nature of pus is always a thick consistency. But whenever it defies the general dictum of the thumb that, no, the character of the pus is not thick, it is thin and watery. What we call in the terms of Metromedica sanious, S-A-N-I-U-S. And that's a characteristic of silica. But Calcareous sulf is always this kind of thick, yellow, lumpy discharge, which is very characteristic of Calcareous sulf. So again, look and diagnose. You get this kind of cystic nodular acne. You ask the patient what kind of discharge is coming out. He's telling you it's thick and yellow. You're done, calc sulf. And believe me, you'll not be disappointed. Similarly, you're coming across cases where there's thin, watery pus. Do always think of silica. And silica will be offensive as well. So that's a differentiation between Calcareous sulf and silica. Now, many times, my friends, looking at the bottom picture, you'll come across cases, especially in young males, say a 17-year-old, 16-year-old, where you find this kind of pitting with the acne. Like acne has left very deep scars. And you can see in the bottom picture, there are quite a lot of scars in the face, especially in young males. Do always think of calibromatum, because in calibromatum, you'll find acne with a lot of scars and pits. And calibromatum works really well in those conditions to help in those pits and scars. Why I'm saying young males? Because you'll find in calibromatum, there's a history of excessive masturbation. So sexual excess. Alan mentions a line in young persons of gross habits. So sexual excess with this kind of pitting and scars, to remember calibromatum. So to start with, again, look and diagnose. You come across cystic acne. What is a miasm? Cystic, swelling, psychotic. What is the character of the discharge? Thick yellow, psychotic. So miasm on one hand, you're putting the totality on the other hand. Cystic acne with thick yellow discharge, you're done for Calcareous sulf. And believe me, my friends, Hahnemann has always mentioned totality of symptoms. Never has he mentioned totality of particular symptoms or the totality of mental symptoms or the totality of general symptoms. It's the totality of symptoms. It can be on any plane. It can be on the mentals, physicals, or the particular plane. And where you do not have a good emotional picture, you do not have a good physical picture, general picture, you can always prescribe on the particulars if it is marked, if it is peculiar. And in this case, it's a typical example of how Calcareous sulf is prescribed. Few other remedies I like to share with you for comparative Metromedica, especially with this kind of cystic acne. I've mentioned here, my friends, do always remember, iodum group of remedies, and this have learned as a clinical tip, works really fantastic for cystic acne. Baryta iod, Calcaria iod works really well for cystic acne. Baryta iod, why? If it's a hot patient with cystic acne, if it's a hot patient who is shy, who is timid, who has poor comprehension and understanding with offensive foot sweat. All iodum group of remedies, do remember, my friends, work beautifully for cystic acne. So do try those cases. Go back to those cases of acne where you are having failures and try Baryta iod. Try Calcaria iod if it's a pair flabby constitution, or if it's a scrawny emaciated iodum constitution in a hot patient with cystic acne. So if it's a shy, lazy, dwarfish patient with cystic acne, with offensive foot sweat, and he's hot, do think of Baryta iod. Whereas if it's a fair, fatty, flabby Calcaria, or a very emaciated appearance which resembles iodum, with the anxieties of Calcaria, with the totality of Calcaria in a hot patient, do think of Calcaria iod. Baryta iod, Calcaria iod works really well for this kind of cystic acne. I hope you understand what I mean by cystic acne. The top picture where you have this kind of bumps and nodules, especially resembles the cystic acne with Calcarea sulf, Calcarea iod, Baryta iod. Difference between Calcarea iod and Calcarea sulf, as I mentioned, Calcarea sulf, there will be the discharge, which is thick, yellow, lumpy. In Calcarea iodata, you won't have that kind of discharge in calc iod, but in calc sulf, you'll always have that discharge. I shared with you Calibromatum for young persons with scarring of the acne, which can be helped with Calibromatum, where you have lots of sexual desire. Another very useful remedy, my friends, again, I want you to try this as a clinical tip, is Asterias rubens. My friends, my grandfather taught me this. This Asterias rubens is a sister remedy of Thuya. So whenever you think of Thuya or Thuja, and you understand it's a deep psychotic remedy, similarly, Asterias rubens is a small member of that psychotic family and is a little sister of Thuya. Why I say so? My friends, Asterias rubens and Thuya are both left-sided remedies. Both Asterias rubens and Thuya are obese, psychotic, flabby. And in case of Asterias rubens, very interestingly, you have a tendency of acne at adolescence. So it can be cystic acne, it can be any other varieties of acne, but especially think of those 15, 16-year-old girls who are having this recurrent pimples which have started since menarche. You have given Calcarea, you have given Pulsarilla, still not working. You have given Graphitis, it's not responding. Do try Asterias rubens. Young girls, teenagers, flabby, obese, you're thinking on the lines of calc, you're thinking of Graphitis, but it's still not working. You have given Pulsarilla, NBWS menarche, never been well since menarche. It's still not working. Do give a chance to Asterias rubens. For young girls with pimples and acne, especially around menarche, adolescents, who are obese and especially affecting the left side. So even if you look at the face, it's more left-sided, and you're done with Asterias rubens. Small sister, younger sister of Thuya, but it has a wonderful affinity for acne and pimples, especially at adolescence. That's important for Asterias rubens. My friends, I also like to incorporate over the next hour as we are progressing that, we all have our list of favorite remedies. We all have a list of remedies which we tend to prescribe and do not go out of our comfort zone. But those of you who are practicing for a long time, I'm sure you understand that we have had success with a specific group of remedies, and it applies to me, myself as well. And do not like to go out of those lists of remedies to prescribe. But, the only way of incorporating these remedies in your practice is by comparing with the remedies which we are using in our daily practice. I'm sure you use Pulsarilla, I'm sure you use Graphitis, I'm sure you use Calcarea for a young girl who is obese with a lot of acne and pimples. In those cases, when you are having failures, put a note in Pulsarilla. Wherever you have notes for Pulsarilla, whichever book you are using, that whenever Pulsarilla fails for acne, which has started at adolescence, in patients who are obese, especially affecting the left side, I'll try Asterias rubens when Pulsarilla, when Calcarea, when Graphitis isn't responding. And in that way, you'll be able to incorporate Asterias rubens into your practice and, utilize these wonderful remedies. If you look in Boricate, this line is absolutely mentioned in the face of skin section, pimples at adolescence. And very many times we ignore this, we do not prescribe these fantastic remedy. So that's the comparative Medica. Cystic acne, thick yellow lumpy discharge, Calcarea sulf. Cystic acne in a fair fatty flabby Calcarea or a hot emaciated constitution, Calcarea iod. Cystic acne in a shy, timid, lazy, dwarfish constitution with offensive foot sweat, Baryta iod. And cystic acne in an obese constitution, which affects the left side of the face, which is more around the time of puberty. Always think of Asterias rubens. So again, believe me, this is how my mind works with slum clinic prescribing. I'm sure you'll be many of you are dealing with patients in a large number day-to-day practice. You may not have always the opportunity to make a complete repertorization or totality, but very many times the skin is in itself telling you a story. So do not ignore to look at the skin. Try and find the totality, try and find the miasm from that itself. Look at this, my friends, and you'll never miss a prescription where you can have this kind of deep, deep, deep cracks in the skin. You see, this is the great toe, and you can see the degree of cracks, the deepening of the cracks, the extent of the cracks. Miasm, cracks, syphilitic. And if you see in the top picture or the three pictures, the surrounding skin of the crack is thickened, is dark. And you ask the patient, when is the cracks happening? Is it in the summer? Is it in the monsoon? Is it in the winter? And you'll tell you 365 days in a year, 24/7. I have this crack. So deep, deep cracks, my friends, where the surrounding skin is thickened. My friends, do always remember, and I want you to please try this remedy in your practice, that is X-ray. X-ray is a fantastic remedy where you have deep cracks in the skin. You can understand when you look at this picture, it's almost going to the bones. That degree of cracks. And the surrounding skin is thickened. So you have the deep cracks, which is syphilitic. The surrounding skin is thickened, which is psychotic. Very many times you'll come across cases of thickened nails, and X-ray works in those cases as well. It's a fantastic remedy where you have cracks all the year round. It's not just summer cracks or winter cracks, but as I mentioned to you, cracks throughout the year, and X-ray will come to your service. If you look in Borique's introduction about X-ray, you'll find it's mentioned. Its action is centrifugal from center to periphery, brings to the surface suppressed symptoms, especially psychotic. So X-ray is a deep-acting psychosyphilitic remedy where you will find very many cases it helps to bring to the surface suppressed symptoms. And even if you do not have the entire psychotic totality, as I shared with you, look and diagnose. You're prescribing on what you're seeing. What you see the cracks, you see the thickening, and you'll never miss a prescription of X-ray. So cracks with surrounding thickening of the skin, my friends, that's a classical description of X-ray. I hope the picture is visible, if anyone can confirm. Yes.
It is.
Yeah, thank you. Just a quick comparative Metro Medica, my friends. Cracks, I'm sure you know and prescribe for cracks. X-ray, as I shared with you, deep cracks, syphilitic. Surrounding skin is thickened, psychotic. So do always remember that's a fantastic area of prescription for X-ray. Also, in association with that, you'll find in X-ray the cracks are all through the year. If you see in the bottom, I've mentioned deep cracks without any seasonal variation and surrounding thickening of the skin. That's classical for X-ray. When you think about Sarsaparilla, another fantastic remedy for cracks, but my friends, in Sarsaparilla, cracks are mostly in summer. Summer cracks. Sarsaparilla is also a psychotic remedy, but you'll find the cracks mostly in summer. And sometimes there's a spring aggravation as well in Sarsaparilla. So this time of the year in the Indian subcontinent, March, April, May, where it's spring and summer is setting in, that is a typical time for Sarsaparilla cracks to spring up. So that's the psychotic aspect of Sarsaparilla, where you have the spring aggravation or the change of weather aggravation. And as you know, Sarsaparilla has a lithic diathesis with a tendency to renal stones. So summer cracks is Sarsaparilla. Now, when you come across to the other two remedies, which are your top two for winter cracks, alumina and petroleum. My friends, I'm sure you use alumina and petroleum in a day-to-day practice, but just prescribing on the skin or looking at the skin, it's sometimes difficult to differentiate. Why? Because both have cracks. What is similar? Both have cracks. Both have a winter aggravation. So how do you differentiate? My friends, again, I've learned this as an ancestral tip. Whenever you think of a petroleum skin, there are two factors which you do not find with alumina. You have a thick, leathery skin in petroleum. So there's a thickening of the skin. There's a leathery appearance of the skin in petroleum, which is missing in alumina. And petroleum skin is very sensitive to touch. So whenever you touch it, you press the cracks, it's painful for petroleum. So a leathery thickening of the skin, it feels like leather. You can understand that's the doctrine of signature. That's the feeling when petrol is greased on your skin. So that leathery appearance of the skin, leathery feel of the skin, that's important for petroleum, A. B, petroleum is very sensitive to touch, whereas you won't find these two factors in alumina. Alumina is more sodic, so it's more dry and rough skin in alumina. But in petroleum, you have the thickening, which is cycodic, and there's a lot of sensitiveness to touch, which is important for your petroleum. So whenever you come across these cases, you have come across cases where a patient is coming to you for long time cracks, or very many times you'll come across cases of psoriasis or eczema where there's deep cracks in the skin, and patient has been to other homeopaths, taken alumina, taken petroleum, there's not much change. Do always think of X-ray when you see these kind of deep cracks in the skin, the surrounding thickening of the skin. My friends, I've used X-ray with wonderful results in chronic cases of eczema, in psoriasis, and believe me, you won't be disappointed because it's a deep-acting remedy. When you look in the introduction, Borike, about X-ray, you'll find it's mentioned about the psychotic factor and how it brings to the surface suppressed psychotic symptoms. So because of his miasmatic coverage, it has the ability to take care of this kind of deep cracks as well. Potency for X-ray is 30C and 200C works really well. I'm not an LM potency prescriber to that extent. I generally prescribe C-scale. So 30C, 200C, I've had good results with that. I'm sure you can go ahead and try these potencies with efficient results. Fungal infections, my friends. Again, quite a common problem, especially in the last year as well, because people have been washing hands more frequently than ever, washing the things more frequently than ever, and fungal infections will always come to your notice. And my friends, to be honest with you, miasmatically, what I've learned, again, from J.H. Allen notes is fungal infections are most often syphilitic. Fungal infections, there is some destructive components, so you'll find the syphilitic component there with fungal infections. Doing a quick comparative Medica, if you see the appearance of fungal infections, the white appearance, as you can see in the bottom picture, and on that basis, and I've learned this again as a doctrine of signature, anti-crude works really, really well with this kind of fungal infections, where you understand the antimonium crudum, there's a white appearance always. The tongue is white, and hence, even with fungal infections which are white appearance, anti-crude works really well. Two factors here: very increased thickening of the skin that you can find, and there's a strong desire for sour, which you know for anti-crude is important. But the white appearance with thickening of the skin and the sour desire in combination works well for anti-crude in fungal infections. So if any of you haven't tried anti-crude for fungal infections, do please take a note, and believe me, you won't be disappointed with anti-crude. Echinacea, I'm sure you understand Echinacea is a local antiseptic, which corrects the autoinfection. Two factors symptom-wise for Echinacea is debility and offensiveness. So general debility you'll find, and very many times in between the fingers, you will find a very bad smelling discharge, or just a bad odor coming from Echinacea, which is important to prescribe. My friends, I use quite often the lesser known or the smaller remedies. And believe me, even with the lesser known remedies, you cannot prescribe just on a single symptom. Herring mentions this: for a stool to stand or a chair to stand, you need at least 3 legs. So for a symptom to be complete, for a totality to be complete, you need at least 3 symptoms to complete it. So even when you're prescribing a smaller remedy like Echinacea, you put on one hand of the triangle debility, the other hand of the triangle offensiveness, the third side of the triangle fungal infections. And that combination works well for Echinacea in those cases to clear up the infections. I've placed 2 great syphilitic remedies in this list, 2 great syphilitic acids in this list of fungal infections. Fluoric acid and carbolic acid are 2 top syphilitic acids. How to differentiate? My friends, fluoric acid, do always remember, is a hot syphilitic. And whenever you come across fungal infections, whenever you come across ulcerations, my friends, where you have the modality of aggravation by warmth and better by cold, do always remember no other remedy fits the picture than fluoric acid. Kent mentions this in his Medica, and have verified this thousands of times in clinical practice. Whenever you come across a syphilitic condition, think of an ulcer, think of a varicose ulcer, think of a bed sore ulcer, think of a fungal infection, where the modality of the itching or the pain is worse from warmth, better from cold. Fluoric acid is always applicable for that picture. Similarly, when you come across an ulcer or a syphilitic condition where you have the reverse modality, better by warmth, that's silica. So ulceration, syphilitic condition, worse from warmth, better from cold, fluoric acid. Ulceration, syphilitic condition, fungal infections, better from warmth, silica. And you understand, Ken mentions this, Pulsarilla, silica, fluoric acid, they follow in a chain. So that works well in that order as well. So if you tell me aggravation warm, better by cold, for any condition, fluoric acid is a top remedy, I'll say no. But if you tell me for a syphilitic condition, for a varicose ulcer, for a decubitus ulcer, for a gangrene, where you have the modality for itching or the pain, which is better from an ice pack application, I'll say yes, fluoric acid is your topmost remedy. So you have to understand the combination of pathology and miasm with the modality. And mute, please. So that's very important factor for fluoric acid. So I want you to please take this in your notes. Hot syphilitic, where you have an ulceration with itching, with this modality of worse from warm, better from cold. So with the fungal infection, with the varicose ulcer, they'll put their feet or hands in ice cold water to always think of fluoric acid. That's classical description of that. And whenever the modality changes, there's a chance of silica. Pulsarilla, silica, fluoric acid, that's Ken's chain of action of remedies. And lastly, you see carbolic acid I have mentioned. In carbolic acid, you can have this kind of fungal infections, but the burning sensation is quite classical for carbolic acid. Carbolic acid is also medicine for diabetes mellitus. So with diabetes and fungal infections, whenever you are burning, you can always think of carbolic acid in those conditions as well. But I will say my top three is echinacea, fluoric acid, antimicrobe works really well in these kind of fungal infections. Obviously, constitutional remedy will be your first chance, first line of action. But again, you are having failures, do always think of these remedies which can come to your service. This is an interesting case of a neck ulcer where you have stringy discharge of blood. My friends, whenever you come across, again, this is a classical slum clinic prescription. Whenever you come across cases where you have a stringy discharge, so it's a catarrhal discharge which is stringy. So think of nasal discharge, think of a mucus discharge which is stringy. You know, you have that in Calibic, you have that in hydrastis. It's a stringy discharge. But whenever you come across a case where you are having a discharge of blood which is stringy in nature, do always remember it's crocus sativa. Crocus sativa is your leading remedy whenever you come across cases where you have a stringy bleeding. And this was typical of this case of neck ulcer. It was malignant and where we have the stringy nature of the discharge, and that's very, very classical for crocus sativa, stringy discharge. Very many times comparing that with Crotalus horridus can also have this kind of stringy discharge, but again, stringy bleeding. But in Crotalus, you're having some febrile conditions. So fever can be there in Crotalus, and it's very, very dark bleeding. You can see the point where it's there. It's generally very dark in Crotalus, but you won't have that degree of darkening of the blood in Crocus sativa, as the snake venoms are more tend to dark bleeding in Crocus, in Crotalus. I want you to look at this picture, and believe me, you won't miss a prescription when you see this picture and understand this remedy. A case of diabetic foot, diabetic ulceration, where you understand there is this deep suppuration. There's a pus point where pus is oozing. And you see again, my friends, you can understand from this that we prescribe on what we see. There is this oozing of pus from this diabetic foot ulcer. and the surrounding skin has turned blackened. There's blackening of the skin of the surrounding part. You can see on the bottom two pictures, it's more clearer comparing the skin of the sole and the skin of the great toe. You can see the degree of blackening with that diabetic foot. Now, whenever you come across cases, my friends, like this of suppuration with blackening of the skin, think of a case of an acne where the acne is constantly discharging pus, the surrounding skin is blackened. Think of a case of a fistula where there's discharge of pus and the patient will tell you the skin surrounding it is really, really darkened or blackened. Think of a case of decubitus ulcer, bed sores, where there is discharge of pus and the surrounding skin is blackened. And my friends, I want you to please take a note of this fantastic remedy is gunpowder. John Henry Clark introduced gunpowder in his practice as a war remedy, especially treating the soldiers in the war who are stuck in the trenches, who is to come down with this kind of circulatory disorders with blackening of the skin. And gunpowder is your go-to remedy. Why I say so? Again, look and prescribe on what you see. I shared with you for Antim crude. It is a white appearance, fungal infections are white. Gunpowder, what is the color of gunpowder? Black. What is the color of the skin here? Blackening, darkening. So that's the doctrine of signature of gunpowder. Septic suppuration with blackening of the skin. And believe me, gunpowder in potency, 30C, 200C, when you give it internally, will always help you to absorb that suppuration and help the patient get away from the surgeon's knife. Because the surgeon is always contemplating and trying to put the money into his pocket and trying to cut the diabetic foot or the diabetic toe. But you can always save the amputation and save the money by prescribing a dose of gunpowder with the septic suppuration, with the blackening of the skin. So always think of gunpowder in these cases where you come across with septic suppuration and blackening. Think of cases of suppurative acne. Think of cases of bed sores. Think of case of diabetic ulcers, diabetic gangrene, any cases of ulcers and gangrene where you have suppuration. Along with that, there is blackening of the skin. Believe me, gunpowder will be always of immense value. 30C, 200C, I've even prescribed up to 1M with gunpowder and I haven't been disappointed. Another remedy, my friends, I'd like to compare here with gunpowder is Carbohymalis. When you think of Carbohymalis, it's prepared from animal charcoal. Again, what is the color of animal charcoal? The color is black. Very many times in Carbohymalis, you'll find this kind of blackening of the skin as well. But in case of Carbohymalis, you'll have one of the carbon features, which is coldness and debility. My friends, all carbonates have the coldness. So when you come across Carbohymalis, you'll have the coldness of the skin. So think of a case of Raynaud's, think of a case of Burgess disease, where you touch the skin, it feels cold. But at the same time, there's blackening or darkening of the skin. And in very many of those cases, Carbohymalis can help you to overcome that condition. You'll be thinking of why not carbo-veg? Carbo-veg vegetabilis is also dark and black in color, but symptomatically in carbo-veg, you'll find there's a bluishness of the skin because of the cyanosis and the hypoxia. So although carbo-veg is prepared from charcoal, it doesn't retain the doctrine of signature. It deviates from the doctrine of signature because of its peculiarity. Because hypoxia, cyanosis, imperfect oxidation is one of the features of carbo-vegetabilis. So you'll find the blueness more prominent in carbo-veg, but the blackening is more prominent in Carbohymalis. And this blackening, when you combine that with the coldness, when you combine that with the debility, it works wonderfully in favor of Carbohymalis. So again, Comparative Medica, when you come across suppuration with blackening of the skin, always think of gunpowder. When you come across cases of circulatory disorders, where there's blackening of the skin, suppuration may be there, may not be there, but there's a lot of coldness, there's a lot of exhaustion of the carbonates. And there you come across Carbohymalis. So you'll have always a suppuration in gunpowder. In Carbohymalis, you may or may not have the suppuration, but what you always have is the coldness because of the circulatory imbalance. You'll always have the exhaustion because he is a carbon at the end of the day. And that way, you'll be able to differentiate between a gunpowder and a Carbohymalis prescription. There's not much look and diagnose in this picture, my friends, but what is important in this understanding of this picture is this is a case of a knee ulcer. It's almost like she was injured and almost a part of the flesh was drawn out. But when a patient comes to you with this kind of ulcers, which looks really raw and what I'll say as an angry looking ulcer, what you find in the Medica, and with these kind of ulcerations, when you come across patients who are telling you, somebody is unmuted, please mute. When you come across this kind of ulcerations and the patient is telling you that it's almost an unbearable pain. It's almost like I'm going to die. It's like the pains of death. My friends, the only remedy which you should and which you must think of is Tarantula cubensis. So think of those appearance of the ulcer where it looks like a raw, angry ulcer. And in combination with that, the patient is telling you it's an atrocious, unbearable pain. I want you to open Banerjea later on or now and have a look, please. In Banerjea, you'll find in Tarantula cubensis, the Cuban spider, that Banerjea mentions in italics. It is a remedy for the pains of death, soothes the last struggles. And my friends, you'll understand this only when you study the Medica. When you open a repertory and look for ulcer, you'll find 100 remedies coming up in the repertory. But this understanding, this expression will only be developed with the Medica. No other remedy in the entire Medica will tell you this. It is a remedy for the pains of death. So think of a patient who is having a terminal cancer with bed sores all over. He's looking for some palliation because of the pains of death. Think of even a case of an acute abscess, breast abscess or a carbuncle, where it's severe, atrocious pains. He's telling you it's almost a pain, I'm going to die. Remedy for the pains of death, soothes the last struggles. There's also a line in Banerjea, you'll find it's mentioned, gives quite remedy for the pains of death. Please do highlight that line. And there's also a line, abscesses, where pain and inflammation predominate. And that's very important for Tarantula cubensis. So, even I'm not talking about just malignant condition, but even benign conditions where there's a lot of pain, a lot of inflammation. If you see in the introduction, it mentions severe type of inflammation and pain. And the pain is atrocious, it is unbearable. Do always think of Tarantula cubensis, my friends. 30C will always help you, even in cases of malignant conditions, even in cases of benign conditions, with this kind of atrocious, unbearable pains. Quick comparison of the remedies which can be indicated in this kind of condition. I shared with Tarantula atrocious, unbearable pains, remedy for the pains of death. So it's not just he's dying, but he's telling you, I feel like it's going to kill me. So that kind of pains of death, that's important. Do always compare this with anthracinum. When you look at this picture, if the patient would have told me that there is oozing of some black blood from this spot, there's oozing of some tardy blood, it looks like tar, the pitch, the charcoal, the tardy blood, I would have said it's anthracinum. So burning plus bleeding, which is black like tar, that's anthracinum. But when you come across cases where it's just the severity of the pain which is troubling the patient, You always think of tarantula cubensis. In very many cases, my friends, that kind of severity of the pain, the patient is sensitive to touch. Many times, Hiprasalt will help you. If they're better from warmth, if there's a sensitivity to the cold, but you do not have that sensitiveness. There's not that degree of sensitiveness to touch, which you find with Hipar. Not the modality of better by warmth, not the splinter-like pains, but you still have this kind of atrocious, unbearable pains. You always think of tarantula cubensis in those cases. You're thinking, why he's shouting with the pains, why he's almost dying with the pains. And that's where tarantula will come to the picture. So this kind of an ulcer with burning plus black tarry blood, that's anthracina. Burning like the pains of death, tarantula cubensis. Again, this kind of ulcer with burning, but the character of the blood is black, thin and watery. BWT, black, watery and thin. And my friends, I will tell you I'm better from cold application. That's sickle core. Again, you see the character of the discharge will differentiate. In anthracinum, it's black tarry blood. In sickle core, it's black, thin, watery bleeding. Any Medica open, you'll find that when she's having postpartum hemorrhages, black, thin, watery. Whenever she's menstruating, she is black, thin, watery. Whenever it's an ulcer on the skin, whenever it's a gangrene, it's also black, thin, and watery. Like the washings of fish. Sickle core is so anemic that even the viscosity of the blood, which you expect with blood, that viscosity is lacking. And that's the consistency of the blood. It's more like plasma and no corpuscles. So it's black, thin, and watery in sickle core. So that is important to differentiate between the remedies. And again, as I shared with you, more than the look and diagnose, it's how the patient is expressing her ulceration is important to make a diagnosis of sickle core and tarantula cubensis. My friends, again, another of my slum clinic prescription. And this is, you can see in the bottom picture, it cleared up with the first follow-up. And believe me, I didn't ask any general symptoms because the skin in itself was in itself a totality to prescribe. The appearance of the skin, that's why I shared with you, my friends, in the beginning, the skin will itself tell you a story. So go back to those cases where you're having failure, look at the skin, try and understand A, the miasm, B, what story it is trying to tell you. Look at the top picture left. What do you see? Dry and rough. My friends, N.M. Chaudhary has mentioned this in his Medica, that whenever you touch this skin, it feels like you're touching the parchment paper. Parchment paper which you use to polish the wood. That rough and dry appearance. You touch it with the back of your hand and feels dry and rough. That roughness is there. And the typical expression is parchment dry appearance of the skin. Why parchment dry? Because it's the combination of dryness and roughness which you find here. And especially in the middle parts. Especially in these parts, I've highlighted that, where you can see the parchment dryness that's important. Dry and rough. Miasm, sora, dry, lack of secretion, hypo, sora. You see there are patches of blackening of the skin. Blackening here, miasm, hyperpigmentation, excess, psychotic. Now you'll see in these areas, there is crack. It's not that prominent, but you can see there is some degree of cracks in that skin as well. Miasm, syphilitic, destruction, syphilis. So just on the look of the skin, you find the combination of miasms, sora, psychosis, and syphilis. If the parchment dryness of sora, remember the word parchment dry, that's only mentioned in N.M. Chaudhary's Medica. Remember the psychotic hyperpigmentation, blackening. And remember the syphilitic cracks. And believe me, You won't have a better description than this for a graphitis prescription, where you have the parchment dryness of soda, where you have the pigmentation, the blackening of psychosis. Why? Because graphite is prepared from black lead, doctrine of signature, blackening. I shared with you earlier on Carbohymalis, gunpowder, where you have the blackening of the skin. And you have the cracks in graphitis. What comes out from the cracks? Watery sticky fluid. And believe me, you can make a graphitis totality based on the appearance of the skin. Again, as I shared with you, is a look and diagnose. You prescribe on what you see. My friends, as I shared with you, I'm not sharing with you any new method and system which only I can do. My heritage or what I have learned is what I can do, you can do as well. So go back to those cases where you're having failures, look at the skin. And believe me, very many cases you may have missed on a graphitis because you did not observe the skin properly. And believe me, I did not ask any other question, putting hand on my heart. And graphitis 30 was a single dose prescribed. 4 weeks later, she came back with the following picture. And graphitis with its skin symptoms, it has the trimiasmatic predominance. What are the other miasmatic features here, which is not in this picture? Graphitis, my friends, do remember it's Tyler's trio of cicatricial diathesis. Causticum, graphitis, silica is Tyler's trio, Margaret Tyler's trio of cicatricial diathesis. Causticum, graphitis, silica. So very many times when you come across keloids, you come across acne scars, you come across cesarean section scars, you come across hysterectomy scars, where you have the blackening of the skin, where you have the dryness of the skin, parchment dryness of the skin with the scars, graphitis will help. Cicatrices, excess scar tissue, psychotic. My friends, graphitis can have suppuration as well, pus formation. So that's a syphilitic feature as well. So whenever you have the sodic parchment dryness, you have the psychotic pigmentation or cicatrices, or you have the syphilitic cracks or suppuration, graphitis will always come to your rescue. But do always make sure you touch and feel the skin, because that's the exact feel of the skin when you touch and feel a parchment paper. Rough and dry, that's the parchment dryness of graphitis. No other remedy in the entire Medica will have this, my friends. So I hope you'll not miss a graphitis prescription based on these symptoms to prescribe. 30C was the starting potency we used for graphitis in that case.
What was that?
Last one.
Okay.
Last one.
No, carry on.
My last case for the day, again, not that much of a look and diagnose, but where you're prescribing on a constitution. My friends, you'll come across loads and loads and loads of cases where prescribing in a calcarea constitution. You're prescribing for the calcarea, obesity, or the anxieties, or the food or the sweating, or the food desires, or the constipation. And very many times you prescribe a calcarea carb, you prescribe a calcarea phos, prescribe a calcarea ars. But do always think of remedies where they are satellite remedies. They're smaller brothers and sisters to your big remedies, big groups, but sometimes ignored in our practice. And this was a case like that, who had this kind of verrucous warts in the hands and feet, and been to many homeopaths who had prescribed many other remedies, all psychotic wart remedies, without any appreciable results. But when he came to us, we did the totality, and it was a typical calcarea constitution, with the anxieties, with the desire for egg, with the constipation, with the head sweats, so all calcarea totality. But what was his present complaint? Warts and warts, verrucous warts. No itching, no discharge, no particular symptoms about the warts. And my friends, when you come across cases like this, where you have warts in a calcareous constitution, where you have fibromas or a lot of skin tags in a calcareous constitution, you see, this is the first follow-up. The hand has started to clear up. Quite a lot of warts went away. You can see the natural skin was gradually trying to come up. The hand wart had cleared up. And with the second follow-up, he was smiling because they were completely gone. A wart which had been there for almost 12 plus years. And my friends, I want you to incorporate this fantastic remedy in your practice, which will be my last remedy of the day, is Calcarea calcinata. Calcarea calcinata is a superb medicine, which is specifically a psychotic calcarea. When you think of calcarea carb, calcarea phos, these are trimismatic calcareas. But when you come across a psychotic calcarea with a lot of skin tags, a lot of warts, and you have all the calcarea symptoms, do always think of Calcarea calcinata. It's a fantastic remedy to prescribe. We have used it in very many cases, believe me, my friends, with wonderful results. We start with 30C, gone up to 200, 1M, even up to 10M potencies with Calcarea calcinata, and we haven't been disappointed. So go back to those cases of warts where Calcarea has been prescribed, calcarb or Calcarea phos. You retake the case, you still find it's a Calcarea totality, give a dose of Calcarea calcinata, and I'm sure you'll be benefited with this fantastic remedy. So I shared with you cases, my friends, where you prescribe on the appearance of the skin, where you prescribe on the color of the skin, where you're prescribing on the miasmatic appearance of the skin, where you're prescribing on the constitution of the person as well, but incorporating the satellite remedies. And I'm sure I've shared with you a few interesting ancestral tips, again, not from me, but which I've learned as an heritage to go back and apply with to your patients. And I'm sure very many people will be benefited. And in today's world, understand the only way to make homeopathy popular is even more popular is by helping out more people. The more people are cured, the more they will believe in this wonderful art and science. Thank you very much for your kind attention. Long live Hanuman, long live homeopathy. Any questions, please?
Sir, acute psoriasis, can you suggest remedies?
Sorry, I missed the question.
Psoriasis or psoriatic arthritis where the suffering is very acute, in acute conditions, best remedies.
To be honest with you, for psoriasis, what I've learned as an ancestral tip or clinical tips, 3 remedies work really, really well, and we've had good results with that. Is X-ray. X-ray works really well. If you have a lot of scaling, which is psychotic, or which is, there's a lot of cracks, X-ray has worked really well. 30C responds well. Radium bromide works fantastically well, even in cases of psoriatic arthritis or acute psoriasis, when you have a lot of itching, better by warm applications. So hot application, heat application makes it better. That's important. And the third remedy I'd like to suggest is Fagopyrum. Fagopyrum has worked wonderfully well, not only in cases of psoriasis, but eczema, where you have itching, better from cold application. That makes them better. If you can type the questions and I can have a look and
Yes, Dr. Banerjea, there are a few questions in the chat box. Would you like to have a look at them?
Thank you, sir. Thank you, Dr. Saptarshi Banerjea, for your excellent and lucid presentation on comparative dermatology with high valuable tips for prescription. Thank you very much. Now, I request our Chief Advisor, the Wizard of Homeopathy, Dr. K. Shivashankar Shah, to pay homage to Dr. Samuel Hahnemann and give his expert comments and reviewing the speaker's oration. Sir, I welcome you to review on the oration.
Am I audible?
Sir, audible, sir.
Thank you, Dr. Banerjea. It's a very good talk, very lucid, useful, and highly practical tips you have given, which are really remembered for a long time by all the practitioners. And it is really lucky to have a speaker like you who has been carrying the gene of homeopathy in your blood for the last 5 generations. And not only that, not only the legacy you are carrying, you are also from West Bengal, Kolkata, the origin of homeopathy in India and the citadel of homeopathy. It's a pleasure to see you on the day of World Homeopathy, the annual's birthday, on which day all of us commemorate the birth anniversary of our master, our father, Samuel Hahnemann. And today we are lucky to have a good speaker like this. Dr. Banerjea, it's not a question, it's only a sort of a, information I'm seeking from you. You have been very often touching the word miasm, psychosis, syphilis, sora, and all that. And while touching the miasmatic name of a remedy, you are also giving the symptoms of that remedy, which are rightly indicated, and on the basis of that, a prescription is given. In that given situation, is it necessary you should think about a miasm? Is my question clear? Hello?
Sorry, yeah, can you repeat that, please?
See, you have been talking about miasms. Say, for example, you spoke about fluoric acid. Fluoric acid, ulceration or discharges, the pain, the modalities, and how the patient is better by cold application. And again, you have been often talking about syphilitic miasm. Similarly, some other drug where you talk about psychosis with warts and all that. Now, what my question is not a question, I want to get some enlightened by you. When you are talking about the strong modalities which indicate a remedy, when you are talking about the characteristic symptoms of a remedy which indicate the particular remedy in that particular case, what is the need for you to, for anybody, any one of us, not only you, to talk about the miasm? You are going by the symptom.
Yeah, I understand. A good point, actually, but my understanding of this, or my explanation for this, it's miasm will only confirm your totality for that remedy. Like when you come across a condition where you're getting a better by cold application or aggravation from warmth, fluoric acid may come to your mind. But when you come across a case where you have this kind of modality when ulceration, that's more adapted for fluoric acid because fluoric acid is a deep acting syphilitic remedy. So whenever you're combining the symptomatic totality with the miasmatic totality on the other hand, it just confirms your understanding of that remedy. Yes, my remedy description is correct, because very many times you'll come across cases where that remedy is indicated and that remedy is of predominant miasm. Like the same way I mentioned for X-ray, where X-ray understanding is psychotic and syphilitic. So when you come across the symptoms and that confirms with not only the symptomatic totality but also the miasmatic totality, it just makes sure, yes, my prescription is correct. So it's in that way useful and applicable as well.
Very, very well explained. Thank you. What my anxiety is that many of the seniors, by virtue of their experience, by virtue of their knowledge, by virtue of their position, or whatever you may call it, they are doing so many things which will really confuse a young homeopath. And miasm is one such thing. I have been practicing for the last 6 decades. I was a teacher in a medical college for a long time. And my point here is, as seniors, you may not come into that group of or club of the senior, that much of a senior citizen as homeopath. But some of the seniors are creating some floatings of new theories, new dogmas, new doctrines, whatever you may call it, and confusing the younger generation. My point here is that not that I am not aware of the miasms, not that I am not aware that folic acid is antiseptic remedy, but ultimately your prescription is based on the characteristic symptoms of the patient which indicate a particular remedy. That is it not enough? Even Hahnemann said, take the totality completely and fully. A well taken totality is half cured. That's what masters emphatically mentioned. In that case, are we to talk about miasms and confuse the younger generation? Because there are so many antagonistic points about the miasm and the drug and miasm and the symptoms. When you are going by the totality of the symptoms, are you obliged to take the miasm into consideration? Hello?
To be very honest with you, it's difficult if if you have different confusing pictures. But when you are following a classical homeopathic understanding, miasm will only help you to enrich the knowledge. That's my understanding. It's not a
That is
debate,
very
anything
good,
like
wonderful.
that.
I am not challenging
But
you. I am not challenging you, Dr. Banerjee.
that's
Yeah.
how I achieve success quickly from my point of view whenever I'm combining the miasm and the totality at the same time. So it's in that way it only helps with patients rather than confusing from my point of view.
Not that you are doing it. I am generalizing it. Not specifically you. Everybody talks about it. I feel honestly that it's a sort of confusion, especially to youngsters who are just coming up in the practice, who are just now set up a practice. But senior practitioners have their own way, again, with their own way of going around things and prescribing and all that. But younger homeopaths, you see, once I was a moderator in a conference, an All India conference, where 3 people presented Materia. It was a talk on Materia. And one homeopath said, I prescribe on classical homeopathy. And another homeopath said, mine is a Hahnemannian homeopathy. So after the lecture was over, that seminar was over, I came down and one of the youngsters from the audience asked me, sir, how many types of homeopathy are there? Because my friend was telling there is another homeopathy called predictive homeopathy. Predictive homeopathy, classical homeopathy, Hahnemannian homeopathy. Don't you think all these things confuse an youngster? Are we helping an youngster to develop more confidence in homeopathy and more faith in homeopathy to practice? I honestly feel we are confusing to the extent that they are running away from practicing homeopathy. Not that you and I are doing it. Many of us are doing it consciously or unconsciously. Do you contribute to my thinking?
You have to teach classical homeopathy, to be very honest, but it's a debatable topic, but I always that's how miasm has come into a family, because we've learned it through classical prescribing. J.E. Challen taught it, and that was incorporated in classical Medica, and that's Bengal homeopathy is all about, to try and incorporating miasms on one hand and the symptomatic totality on the other hand. But when you go to other places, you have 10 miasms coming up, so that's always confusing for a newcomer. So if you read classical literature and learn miasm from that, that's absolutely fine. But when you come across different notebooks and try and learning different sensations and 10 miasms, that's when it gets confusing and difficult.
Thank you, Banerjee. Thank you, Dr. Banerjee. Thank you very much. It's a very enlightening talk, a very enlightening discussion. I feel it's a great privilege to interact with you. Thank you very much. So thank you, Dr. Gopal Krishna, the president of the association, Dr. Durga Prasad, the secretary, for giving me an opportunity to say these few words. Thank you.
Sir, alopecia totalis, can you guide?
Thank you, sir, for interacting nice point. Thank you very much for giving your expert comment. And now, before vote of thanks, I would like to inform you an important thing, that there will be another session on the name of Ramaya Memorial Oration in this month only, and the date and time we will inform you later. And just for your knowledge, I am sharing this. And Dr. Ramaya Memorial Oration will be in the April month only, probably 3rd or 4th week of the April. And now I request our treasurer and the host of this webinar, Dr. Venugopal Gauri, to to give a brief concluding remark and present vote of thanks. Venu.
Thank you, Dr. Durga Prasad Garu. Dr. Banerjee, do you have a couple of minutes to take a few questions? Is that okay? Before we close. Dr. Banerjee, could you hear me?
Yeah.
Okay, carry on.
Would you like to take a few questions, or should we close for the evening?
I can take a few. It's all right. If you can.
There are some in the chat box. I would just read them out.
Yeah, I read them, but these are quite vague questions, actually. You know, you can't discuss those in details. So somebody asked for alopecia totalis is itching in old people. So I looked at those, but any questions which are there, you can email me. I can get back if anybody else wants to do that.
Thank you, Dr. Banerjee. Yeah, thank you for the association for giving me an opportunity to say a few words about the evening today. Dr. Banerjee reminded me of my student days, my internship days when I was working with Dr. Shiv Shankar sir. I saw a lady walking on all fours, if I can say that, because she had a perianal abscess and she was unable to bear the pain, and she was taking the help of these two hands also to walk. And that is when Shiv Shankar sir prescribed Tarantula cubensis. And I won't tell you what happened. She just got cured about it. So Materia Medica is the last court of appeal. That is what Dr. Banerjee has stressed for us today. There could be many schools of thoughts that can come into existence, many ways and approaches, the way homeopathy can be practiced. But the fact of the matter remains that it is the Materia Medica and the symptomatology that is going to draw the patient closer to a cure. And that is how we are going to endear ourselves to humanity by practicing homeopathy accordingly. Thank you, Dr. Banerjee. That was a wonderful talk. And you are an accomplished homeopath. We are aware of that. And we will take more time from you in the days to come to help groom young homeopaths of this part of the country also. And interestingly, as I would like to say that homeopathy in Hyderabad has come down through the Mecca of homeopathy, Bengal, and also from Pakistan. That was much before Indian subcontinent was divided. So here we have a mixture of all kinds of homeopathy, and we practice it to the benefit of the society here, suffering here, and something more like what you have in Bengal. So definitely it will be a good experience for you to see what is going on here also in the days to come. And I thank our President, Dr. Gopal Krishnaji, Dr. Durga Prasadji, our Secretary, the convener of this evening, Dr. Sampath Raoji, and all the delegates who have come this evening and enjoyed this beautiful presentation on dermatology and how it can be just looked at and given a good prescription about by our endearing speaker, Dr. Saptarshi Banerjee, and Dr. Shiv Shankar sir for those beautiful comments and explanation and drawing Dr. Banerjee into a beautiful debate in this Hanummanian month. Thank you, everyone. We will get back to you very soon with a very good speaker like Dr. Banerjee in the days to come. And we will meet again this month, as our secretary has said so, for the Ramaya Memorial Oration here. Thank you, one and all.
Sir, anything to say?
No, that's it.
Okay.
Yeah, we'll conclude. Yeah, thanks.
Okay,
everybody.
sir. Okay. Thank you.
Thank you.